more than a couple of days of bed rest actually seems to make it worse. Well, look, it really comes down to why something is painful. Okay? So there is a time to rest. There's a time, or especially for relative rest. So after a trauma or what we call an acute injury, there's a time to rest. Okay, even chronic impact overuse injuries, there is a time to rest. Whether that's tendon or reactions in the bone, there's definitely a time to relatively rest. And that's when your physiotherapist, sports physicians, people like that will be able to guide you on how much is too much and how much you should be doing. But after that acute period of rest, now if we talk about back pain, we're talking about a couple of days. We talk about tendon injuries, maybe a couple of weeks. We talk about bony reactions, it can be weeks to months. Right? So it really depends what structure we're talking about. When I talk about back pain, I'm talking about simple lower back pain, not with nerve injury, actually even with nerve injury. More than a couple of days of rest there has actually been shown to be unhelpful. So I'm talking about bed rest. So more than a couple of days of bed rest actually seems to make it worse. Tendons, they want to be reloaded at some point. You leave them to rest for too long, that lack of structure or the degenerative state of the tendon just gets worse or it certainly doesn't get better. So actually you want to reload that tendon so it adapts and essentially grows more tendon around it. It's very oversimplified. So you actually have to gradually reload it and actually sometimes cause a little bit of pain to stimulate you healing. Bones, on the other hand, there's a certain time frame to that. You do then want to load progressively. There's something called Wolff's Law, which means that the bone will only lie down in the lines of stress that you put upon it. I'll let you sit with that for a minute. Okay? So if you don't load a tissue, when the body goes and heals it, it will heal crisscross. You start to load it, it says, so that's how I have to lie down. I have to lie down in this direction like this, because I need to be able to later take force like this.
So it heals in a way where it can support the stress at a certain point.
Absolutely. Yeah. So no, when you do that is a little bit complicated. It's a bit of an art, a bit of a science, and that's where your professionals will guide you. But just resting blanket, which unfortunately is the advice that's often given out by some primary care providers, is not always helpful. Okay, so there's a time to start moving, a time to start loading, and that can facilitate healing and return to function.
What you're saying is, if you do that in a sensible way, you will actually heal faster.
Yes. The key is sensible way, and I don't expect the public or people listening to this to suddenly think, oh, okay, I need to move and I need to start doing things. It does take some guidance, and that's why people train for years to be able to offer that guidance. But the most important thing, they don't think that prolonged rest is going to cure them. Maybe if they haven't got better, then they need to rest for longer. Sometimes it's time to start moving again, start strengthening again, start reloading in the right ways, and that's what's going to facilitate healing.
So certain parts of your body really want to get moving in order to strengthen itself.
Yes, it's interesting you bring up the shoulder. The shoulder is a joint that really relies on stability from the muscles around it. So if you sit there waiting for things to magically be better on your own, you're probably going to lose muscle. Okay, we would say the word atrophy, right, which means the muscles get smaller and therefore lose stability. There's certainly those tendons. They might settle down initially, you might quieten down, but they're not going to adapt in any way. So you're not going to regain the ability for them to take load. Especially, I see this quite a lot in tennis elbow. I'm sure a lot of people listening will have had tennis elbow at some point. Tennis elbow is a great example with some very clear research where if you have a steroid injection into the elbow and then you don't reload the tendon, you'll feel great initially. The steroid will take down the inflammation. 3 months later, it will come back with a vengeance and you'll probably do worse than you did before. So we know that steroid injections for a tennis elbow without rehab will lead to a worse outcome than not having a steroid injection.
The tendon behaves almost like a muscle in a sense. Because Because I mean, when
you don't use it, you lose it, kind of thing.
Yeah. You load it in order for it to grow stronger and be more fibrous and stuff like that.
Yes, so the new we're really evolving in our understanding of how tendons work. You know, tendons transmit load, right? So there are attachment points from the muscles to the bone. They're not really contractile, but they allow a lot of power to be transferred. The Achilles tendon is incredibly important in power transmission, for example. So that's one thing they do. But what we're understanding now is that tendons don't in that broken area of the tendon, part that's degenerated, it doesn't necessarily heal, okay? But we do grow more tendon around it. So imagine like a donut, okay? So that middle part of the donut, the hole, doesn't necessarily change, but you do grow greater tendon, or like the ring of the donut around it, and that's how we heal. We also know that, and that comes. I'm not going to go on with that imaging. Okay, but essentially we'll leave it there for tendons. But yes, you need to reload them so that they adapt. Okay, I'm Matthew Winter. I'm a physiotherapist, director of Integrative Physio, which is a clinic that I set up about 5 years ago in order that we look at the whole patient. So I really wanted to get to the root of what was going on with patients, understanding that it's not always structural. And there are other things involved in pain and in leading to injuries as well. So I wanted to look not just at the pathology or what was going on, the straw that broke the camel's back, but also the biomechanics of the patient, the world around them, their environment, their habits, their training, their belief systems, and even their nutrition. So it was really about taking a 360-degree view of patients in order that we get back to where things started going on. I worked in Singapore for about 11 years now, and I trained in the UK at Nottingham. I worked at Tan Tock Seng, did my rotations there, and then in elite sport and national sport, and work a lot in medical education, dealing with pre-hospital injuries, pre-hospital emergencies, and that's my other kind of passion. So I guess sports injuries, pain management, and then pre-hospital care.